So we are doing a hair transplant for this gentleman. So you can see from the front that he's having a hair loss in the front part of his scalp. So this is normal hair pattern baldness. So also in the sides of his head, in the temporal region, he's having a hair loss, normal hairline recession. So we are going to take the hair follicles from the back side of his head. So he's having a good density here. So these the follicles will be taken from this side and will be transplanted to the anterior talebaksi part of his scalp, so that there will be a hair growth from hair follicles that will be taken from this part of his scalp. So this is a FUE technique that we are doing for this patient. So this is a very good and safe technique where the patient will get very good results and there will be no scarring. This is the most important thing in this technique, unlike FUT. Also that we are doing this under local anesthesia, so patient don't have to undergo a major general anesthesia. The recovery is faster, the downtime is better, and also in this technique the hair follicles that will be taken will be prepared nicely, will be prepared to the transplanted area. The hair growth will be just normal, like a normal hair growth will be seen in week or 10 days. So this part of the hair follicles are genetically stronger. That's why when we transplant from the back side to the front, the hair growth, hair follicles tend to be remain for longer period. So we are now shifting the patient to the operation theater. So in our hospital setup, we are doing this in aseptic conditions in the general operation theater in a better way, in a sterile environment, so that there will be no infection. And now the patient will be shifted, will be prepared. We are going to prepare the scalp, we are going to shave this area and prepare the skin using antiseptic solutions, so that there will be no chance of infection post transplant. So we are going to show you step by step, each step, how we're going to prepare the scalp, how we're going to drape the patient, how we're going to extract the hair follicles, how we are going to prepare the follicles, and then also how we are going to transplant into different sites of hair loss in this patient. And this is going to be a painless procedure. We're going to inject local anesthesia to the various part of his scalp. So now we'll be shifting the patient to the operation theater. Thank you. now 3 days following hair transplant surgery. You can see the follicles are intact, and he's being following all the post-op instructions except giving a saline spray which was told to him. He's still not doing it. So this is now just 3 days. Follicles are just settling into a new place. So this is just 3 days results. We're gonna come up with the follow-up videos. I'll show you the backside area as well, where we had taken the grafts. So this is also clean. So this is also healing well. We are applying some ointment there. Alright, thank you.